in breast imaging, we were already using computer-aided detection for, like, I would say, maybe even like two decades ago, where there will just be bring a scanner on a cue card, and then you insert it, and then the markers will show up. That was a very crude way of doing it, but then finally the AIs come up, and some of the tools now are embedded in the images, and is one click away, and you can see them. It's not 100%. We use them as an adjunct, but it has cut down on some of our processing time. So that's number one. And number two, what I'm really enthusiastic, what it would do is at 3 different levels. Number one is going to be in workflow. The radiology office as well as radiology department in a hospital, their workflow means requisitions coming in from different parts of hospital or different specialties. They're channeled properly, and patients are scheduled properly. And so there are many different layers to it. All that can be done. Probably AI can play a very significant role in each and every part of it. I have to be careful here that it's not like AI can do all of that stuff. There is, a significant amount of human interaction needed. But at each layer, it can play a role from scheduling to results communication. And second, where it can play a role is the image acquisition and processing. Image acquisition right now, the protocols for each and every indication, they're still pretty stiff. But they sometimes don't show the some nuance which is needed to be able to structure it for a particular patient or particular clinical context. So that where AI could play a role, it could actually advise a technologist in real time that, hey, you can add this image also because I'm already seeing this, and patient has a history of that. So that way it can play a role. Third, I would say, is in image interpretation, making image interpretations faster. AI being used in stroke imaging is a very helpful tool, but I think it can also play a very, very good role in interpretation of trauma CTs in future, or at least the first triage through those. And it can play a very important role in tracking lung nodules. Yes, some work is being done, but right now I think this is a mishmash of different approaches all across the country. But I think it can be made more uniform, and then it can play a role in all the screening tests. Screening tests means including mammography, CT colonography, in prostate imaging, and take any screening modality. I think it can play a role.